Hello, everyone. Welcome to Facebook Live. I'm Dr. Annette Mercatante, the Health Officer of St. Clair County, and I'm going solo today. Justin Westmiller is taking a break, and he'll be back next week. So we're going to get right to the data and then get to your questions. This is the updated numbers from this week. As of today, there's 12,259 total cases. That's up 1,440 cases since last week. We have currently 585 patients hospitalized. All of our hospitals are reporting being busier, but still having capacity, both in their ICU as well in their ERN units. So if you're sick, you can still go to the hospital, but do expect maybe a little bit more of a wait. We have 270 deaths. That is up 14 deaths since last week, average of 2 per day. And we've recovered 8,745. And I'll just a caveat there, those recovered numbers are reflected by removing names from the MDSS system and putting them in as recovered because they've completed their 10-day isolation period. And with 1,440 new cases in the past week, I can guarantee you we're not getting to all of these cases. So you need to follow the guidelines. This is a very telling graph. This is where we're at now. You can see both the shape of the curve and the top of that curve that we are not yet seeing a plateau. Once we plateau, there's typically a week or so there before we start coming down. So we're not out of the woods yet. Clearly much higher level of new cases than we've seen in the past as well. Next slide. And then this is our data slide. So we often interpret this to show that we're doing enough testing, but I spent a little time trying and I didn't clarify that on the first slide, but we have 26.8% positivity in our testing. That's really important because that's higher than we've ever been. So what do we need to do with testing? And I hope I can touch on this a little bit, but basically we need to test more so we are in a better opportunity to really understand where things are going. So back to that slide, you can see that we're maintaining our testing, but our average percent positivity is starting to creep up. We need to test enough where that red line starts to go back down, if that makes any sense. So we'll be working really hard in the next week or two to get more testing in the community. And of course, it all depends on you guys reaching out and getting the tests if you feel there's been an exposure or you're getting that little springtime tickle in your throat. That may or may not be an allergy. Okay, and here's our vaccine data, at least some of it. We have administered close to 55,000 vaccines to our St. Clair County residents. Have had at least 27.5 have had at least one dose, and 56% of the 65 and older have had at least one dose. And you can see that we're doing well with the graph. If you draw an invisible line up there, you can see that we're steadily vaccinating more and more people, and that's because we're steadily getting more and more vaccine. As we were clearly this week, we're in a position where we could open up that large clinic in Marysville, and next week we should be doing 2 of them so that we can roll this vaccine out as quickly as possible. I'll talk about that more later. And then this is just a reference a little bit to give you an idea. So the black bar is case rates. And you can see that we have a disproportionately high, again, younger people are representing a lot of our cases. And then the blue bar is those that have initiated vaccine. And you can see there's a lot more older people. Those last 2 tall bars are 70 years old and greater that have initiated vaccine. So this is reassuring, and more data is coming in that's very reassuring that the vaccine is in fact reducing the number of cases in the age groups that are more heavily vaccinated. Likewise, this could be why we're seeing a little bit younger age distribution in the hospitals, because it's really our older people that we've focused on most initially. The other thing I think that's important to remember is that the age group has opened up as of Monday, it'll be 16 and over, and we'd like to close this gap. So we'd like to see these blue lines a little bit more spread a little bit more evenly within the next month. So hopefully that'll temper our case outcomes. Even though we have a lot of cases, hopefully that'll temper how many people end up really ill or sick in the hospital. And just to remind you, go to our data dashboard. There's also some great state dashboards that can, if you're a number person, you can kind of follow the numbers. Bums me out. I get to the point where I don't really want to see the numbers. I just want to know which direction we're going. So that's it for data. And of course, if you guys have further questions, my data guy, Brandon, he's also taking a break this week. I love all those people taking vacations. And so don't give me any stumpers or give me the stumpers. I'll write them down if I don't know them, and we'll make sure we get you the answers as soon as he gets back. Okay, before we get to your questions, a couple of talking points my staff wanted to make sure we went over. One is the PEG system. What does PEG stand for again? I forget. But it is a tool that we have received through the state that allows us to contact anyone that tests positive with a COVID-19 test via text or email. This system notifies the person who's positive of their results, and it tells them that they need to isolate and to tell their contacts to quarantine. So it kind of gives the power and the information directly to the individual. It offers them the opportunity to self-complete a form that captures the information that we collect when we send out an interview, and saves our staff obviously a lot of time. Not only time, but it provides us the information we need, especially if we don't get to you. So I want to urge everybody to respond to this system if they do get a text. We'd like you to fill out the form as quickly as possible, hopefully no later than 24 hours. And you're going to get a text notification with a 5-digit number, which is 48355, 48355. And it includes a link in their form with the message St. Clair County Health Department has sent you a message regarding your COVID-19 test results. Reply stop to unsubscribe. So that's what you'll get. So it shouldn't be too confusing. It's not a hoax. And we'd really like you to respond to it. The email notifications include a message from that local health department and access to the form as well. So that's our new PEG system. It's really important, probably more now than ever, that we try and keep up with what's going on out there in the real world. So please comply. A little discussion about quarantine guidance. Lots and lots of confusion. But first of all, isolation guidance has not changed. If you are sick and have tested positive, or even if you're not sick and tested positive, you need to isolate for 10 days and do your best not to expose yourself to any other individuals who are susceptible to infection. 10 days, and that's assuming at the end of 10 days that you're feeling better. If you're still sick as all get out at the end of 10 days, please don't end your quarantine, or excuse me, please don't end your isolation. And you can give us a call, or you talk to your doctor. Some people, very few, but some do take longer than 10 days. So 10 days if you're sick. Now, if you're exposed to somebody who's sick, you are a person who's been exposed to a case, that's when our quarantine guidelines kick in. And ideally, quarantine is still 14 days. Okay, 14 days is still the magic number. And it is particularly the magic number if you've been exposed to a variant. And now, let me just tell you a little bit. There's a lot of variant activity going on in St. Clair County. So you may or may not know it, but I would like to encourage everyone, if at all possible, to push that ball to 14 days, if at all possible. Now, the CDC and the Michigan Department of Health and Human Services and the St. Clair County Health Department have concurred that a quarantine can be reduced to 10 days under certain circumstances. And those circumstances are: you haven't been exposed to a variant, you still feel well, and you can continue to monitor for the full 14 days. We, the health department here locally, as well as most of the local health departments throughout the state, and the state health department have not adopted the 7-day quarantine with the testing option. Okay, and that's because we have accelerating cases, we have variant expansion, and this is not a good time to reduce our standards when people are getting sicker and sicker. So we can talk about that later when the other side of the curve, but for now, there is no testing option to get out of quarantine faster. One more thing, and that is vaccines are working. This is some local data. So since December 1st, 2020, there have been 7,058 cases that we know about that have been referred to us. Out of those cases, 172 or 2.4% have reported receiving at least one dose of the COVID vaccine. So 2.4% of all the cases we know of have received at least one dose of the vaccine. But out of the 172 that are reporting at least one vaccine, less than 5. Is it less than 5 or is it 4? Okay, it says less than 5 had reported being fully vaccinated. Fully vaccinated meaning 2 weeks out from your last dose or your second dose of the Moderna and Pfizer, which most people have received in this county are the 2-dose series. And that is a very small percentage of people who we are aware of who are getting sick after being fully vaccinated. This is being supported through national data as well, although I'm hearing all kind of anecdotal reports of people saying they're sick after they've been vaccinated. So we're just going to have to keep on top of this and really watch this data. Also of note is there has not been a single death in St. Clair County with somebody who's been fully vaccinated. So again, that's the result of hopefully it's not so much we hope it'll prevent disease, but we even more hope that it's going to prevent hospitalizations and deaths. Okay, let's get to your questions. Where do we want to start?
All right. Doc, if you want to start, we had some questions. We had a lot of questions yesterday that came up on our Facebook Live reminder post. So we try to consolidate them because there are so many. But we'll start with the first one. Why aren't the elementary schools shutting down?
Well, there was no blanket order for schools to pause. Okay, and I hate to use the word shutting down because we go from in-person learning to virtual learning, although we all recognize that virtual learning for some students is really not ideal. So the schools meet with us every week. We go over data, both our data and their data, and we look at how well things are going. And in many situations, as you know, they weren't going well. Some of the school districts did not pause. And some school districts clearly did not see a lot of difficulty in their elementary schools. They were having difficulties more in their middle schools. And when I say difficulties, I mean identifying positive cases with broad exposure and lots of people having to leave out. So that is really the way we approach this, is not saying, oh my gosh, you got lots of cases. We look at it as what's happening in that particular environment. And if the school systems and us are satisfied that it's being managed well, then they've continued on. And that's how we're going to continue to manage this, I believe. It's not do a blanket across the board, everybody has to do this thing, but really look at the situation case by case and try and make sure that we're on top of it.
All right. The next question, when will we have drive-through vaccine opportunities?
Soon, I hope. It's been pretty cold, and one of the issues we've been having is finding a location where our vaccinators don't get their fingers frozen, and we can, obviously we have to manage the vaccine as well at a certain temperature. So we definitely know that we'll be opening up drive-throughs as the weather warms, but we're still looking at options always, because I do think a drive-through option is very favorable for many of our residents. So stay tuned. It's on our radar. Just trying to find a place to do it.
All right. Next question. What if you get sick in between your first and second dose and you have to delay that second dose? Can the health department guarantee you will get the second dose no later than 6 weeks after the first, as recommended by the CDC? And also, is it okay if you get the second dose after 6 weeks?
So the ideal time frame, based on what we know with the clinical trials, is to receive the second dose within 6 weeks of your first dose. That's ideal. So the question is, you get sick in between and you have to delay it. Of course, you do. You can't help getting sick. You have to do what you got to do. Some people have to delay it because of personal emergencies, travel, all kinds of reasons. It happens. What we can guarantee is that we will provide you that second dose as soon as you are able to get it. Okay, there's probably not a single week that we have where we can't work in a second dose for the handful of people who need it. So I hate the word guarantee because that means that without exception, but we really do bend over backwards to try as soon as people are able to get their second dose, especially if they're delayed, to get them in. Now, the third question, is it okay if you get your second dose after 6 weeks? And the answer is probably. We don't have a lot of data to prove that, but it certainly is okay in all the rest of the vaccines that we use. We just don't have the data to really prove it. So if you have to get your second dose beyond that 6-week period, get it. Don't worry about it. Personally, and I think most scientific consensus is you're going to get that positive benefit, that booster effect, and you're going to be hopefully just as protected as somebody who did it within that window. So that's the best I can say about second doses.
Okay, so the next question we have is, what are the guidelines for vaccinated persons to quarantine if exposed to someone with COVID-19?
Okay, so I went over that in the beginning, the talking points. The guidelines is 14 days is ideal. And by the way, it's 14 days from the last day you were exposed. So if you're living with somebody who's got COVID and they are infectious for 10 days, as we talked about, isolation is 10 days for being sick. They're infectious for 10 days. And you're living with them and you're not living in the basement, you haven't separated yourself, then your quarantine period begins on the last day of their isolation period, which really is like 24 days from their first diagnosis, right? It can really add up. So I want you to think about this: 14 days from the last day of your exposure. Now, if you're exposed at a workplace, whatever, it's from whatever you were there. Now, you can reduce that to 10 days, as I mentioned, as long as you're not ill and you are not high risk and you haven't been exposed to a variant. But I want people to understand that these variants are coming in fast and furious, and it's here. So I would say there's a pretty good chance you've been exposed to a variant, and you should try and try and keep that 14-day mark to stay quarantined. And those are your only choices. And you can't test out of quarantine. Not yet. We're not adopting that yet until we're on the other side of this horrendous curve.
And just to clarify, Doc, the question was, if you are vaccinated and you've been exposed, are the quarantine are they different for those folks?
The caveat. So that's the
Yeah.
caveat. So if you're exposed and are fully vaccinated, meaning you're 14 days from your final dose, you are exempt from quarantine. We're assuming you have enough immunity that we're going to allow you not to quarantine. But it doesn't mean that if you get sick, you shouldn't test. As we just talked about, there are people who are having breakthrough cases. So if you're getting ill, isolate yourself and get yourself tested. But we're not going to recommend quarantine. And by the way, if you have recently recovered from COVID and you know you had COVID because you had a positive test, you can also not quarantine with exposure, but only for 90 days after your natural infection. We're not sure if natural immunity lasts as long as the vaccine. So we're limiting that to 90 days. You might remember that we were limiting the vaccine exemption for 90 days too, but we have opened that up. The data is there that shows more long-lasting immunity with the vaccine. So there's no endpoint after vaccination, after exposure, to be exempt from quarantine, but for natural infection, it's still 90 days. Clear as mud, right? That's why people are confused. Go to our website. We did try and put a summary on this, and we'll keep it updated. And we do have a nice one-pager now that you can go through and give to your employer, give to your sister, whoever is confused about the quarantine times, because it's understandable.
Yep, we just updated that, so that'll be up shortly. Next question, will all students be tested before they return for spring break, from spring break?
Testing is not mandated for return to schools, but testing will be available free at no charge at several pop-up locations. We have 3 testing spots that are open and they are available. We'd like some pre-registration, but they won't turn anyone away, and there's no out-of-pocket expense. And especially if you've traveled or gotten together with a variety of people for the Easter break, whatever you're doing, it's be extremely, extremely helpful to get tested, just so we don't go back to school and boom, within a few days have the same problem we had before. So pop-up sites, we're calling them pop-up because they'll be available just for that one day. And I do want to say that we are working as well to bring in more testing capacity 5 days a week. And I'll talk more about that hopefully next week. It's not yet set up, but we're going to bring in more testing so that if you miss this pop-up site, you don't have to wait for days and days to get your results. All right, so Port Huron High School is having their testing on Sunday, April 4th from 12 to 6 p.m. and that's at Memorial Stadium. Okay, and St. Clair High School, I'm going to do it in chronological order. St. Clair High School is having theirs on Thursday, April 8th from 10 a.m. to 4 p.m. and that's going to be in their parking lot, the high school parking lot. And is that true? St. Clair High School in their parking lot? Yes. Okay. And then I know Yale High School is going to be in their parking lot. Yale High School is on Friday, April 9th from 12 to 6. And by the way, this isn't just for students and their parents. Anyone in the community can take part in this, especially Yale High School. If you're going to PAC or Croslex and you want to take advantage of this testing capacity in St. Clair County and you're in Sanilac or Lapeer, please do. We're all in this together. The virus really doesn't care what county you live in. So please, please, please consider getting tested. Yes, it might mean if you're positive, you're going to have to stay home for 10 more days. But isn't that better than going to school and having another 28, 30 kids exposed that also have to go home for 14 days? So it just helps everybody out, and it's the right thing to do.
Thank you, Doc. And just so people know, pre-registration is encouraged, and we actually posted about that, those pop-up testing opportunities at noon today. So look back on our social media to find more information about that. So let's dive into the live questions. There's a lot. How many have passed as a result of getting the COVID shot, and were there underlying conditions?
So I don't have the exact numbers. I'm sure there are deaths reported post-vaccine, but I do know this. There are no deaths, none, 0, in either the clinical trials or currently, the last I looked, in the VAERS system that could be attributed to the vaccine. In other words, when you vaccinate 70 plus million people, there are going to be people who get sick or die within a short time after the vaccine. That doesn't mean that because they were temporally related, they were causally related. And so each one of those deaths is investigated very, very carefully, and it's determined whether or not those deaths are in fact related to the vaccine. And from my understanding, there has not been any related to the vaccine. So that's reassuring. Of course, that's what we would want to know to begin with to even authorize the vaccine. So that's the kind of data that we look at. So as far as saying there's no deaths after the vaccine, of course not. Of course there have been, but there have been no deaths that have been attributed to the vaccine since it's been used. And I will double check that for you, because that was my understanding as of 2 weeks ago. So maybe in the last 2 weeks there's been a change, but I don't think so, because things like that get plastered everywhere, right? And that's the kind of stuff where they would have emergency webinars for us if there was some relationship to this vaccine to a medical condition. And I'll just say this as well. This system, this post-utilization system, surveillance system that we use for vaccines in this country, there are 4 of them. Actually, there are 5 of them now with the V-Safe that we want all of you guys to use that have been vaccinated. Please sign up, you get your vaccine. Those systems are there to identify any flags or any kind of indications of a certain anything occurring, death, migraines, whatever the case may be, that could be greater in the vaccinated population versus the unvaccinated population. And to date, there have been none. There have been none. Okay, there has been no greater medical adverse outcome associated with the vaccinated group versus what would normally occur in the general population over the same period of time. So I think that's reassuring. I mean, that's the best we can do. Let me tell you, we don't do that with, shoot.
You're still on, Doc. Oops, it looks like Doc's
Okay.
frozen here.
Am I back?
Oh, yep, you're back. Oh. All right. I'll give her a minute to reconnect here.
Okay.
You're back.
Sorry. So I just want to say that kind of surveillance is not done really with any other medication that we use in the United States. So that's why we say our vaccine supply is one of the safest in the world. And I really do believe that. So I've used medications, prescription medicines for all kinds of things, and we don't have that level of surveillance for anything else. So it makes us feel confident to say, yeah, it's safe. Okay, please go ahead. I'm rambling again. I apologize.
No. You're okay, Doc. All right, next question. What if you take the first shot and have a bad reaction and do not take the second shot? Will you still be protected?
Probably. And you'll have some protection. We just don't know exactly how much. Some of the clinical trials suggested 50%. I've seen some other post-utilization trials that are suggesting maybe even 80%. I think it depends on the person, and we'll know more as time goes by. But we are saying that if you've had a serious reaction to the first shot, and I don't mean your arm hurts and you have a fever and a body ache for 24 hours like I did. I was a couch potato for a day. Second shot, I was good as gold. But I mean serious, where you had to go to the ER or you had to have some kind of resuscitative treatment, then we don't want you to take the second dose. And you'll just have to live with the 1 dose at this point till we know more. Right now, there's no advice to get vaccinated with anything else either. So you just have to hold off. But I do think you'll have some protection. That's the good news.
All right. We have a lot of school comments and questions, and one of them just says, should schools be shut down longer? This is very concerning.
Mm-hmm. We'll find out. What can I say? Okay. If we go back and there's tons of cases, we're going to be having the same conversation. I'm a little concerned, I'll be honest with you, that schools will be returning. If you look at our graph, right, the schools are going to be returning at the peak of our transmission period. It's going to be tricky. And I'll tell you what, it's going to depend on what all of you do when you send your kids back to school. Get your kid tested. Make sure that they're not getting exposed before they return. These are the kinds of sacrifices we have to make if we want to keep our kids in school. But if we send them back and there's a lot of problems, yeah, we'll just have to cross that bridge when we get there.
All right. We have another question. It's just asking about testing in elementary kids because they aren't testing. They could be contributing to the community spread.
Yeah, you're right. So mandated testing by the state was really focused and based on where the lion's share of the problems were, and that was with sports teams. All right. So right now, the only testing that's required is the sports teams because that's where the problems were. We have problems in middle school and high schools, a few of the elementary schools, but for most part, younger kids don't seem to spread as much, probably because they do what they're told and they sit in their desk with their masks on, and it's just a more controlled environment, right, than your adolescents. So elementary schools have not been really focused on testing because the problems just haven't been there. Some of this is resources. So, every time you say somebody's got to get tested across the whole region, you got to have enough tests to do it, and you have to have enough manpower to do it. It's not like, you can just walk through a door and get tested. There's people involved and reporting involved and equipment involved. So it's a big deal to say an entire population that fits into this category needs to be tested X amount of time, which is why we're not even saying all high schools and middle schools need to be tested, right? We're just saying the testing is there. Please take advantage of it. And if you have a young kid in elementary school, please take advantage of it. We're really worried about the middle school, high schools, because that's where we've had the most trouble. But certainly elementary schools are invited and encouraged to test as well.
All right. We just had someone questioning if folks are really on vacation or if they have COVID. Just want to address that, Doc?
Sure. Is it vacations or do they have COVID? I'm not sure I understand the question.
I think they're referring to Brandon and Justin being out on vacation.
No, they're really on vacation. Yeah, but to be transparent, many of us have already been infected. Most of us have been vaccinated. We're just human beings as well. When they come back, we're going to encourage them to be tested and to quarantine before they return to any kind of public exposure duty. That's our policy. And I would encourage anybody who's running a congregate setting, an extracurricular activity, a business, if you have people who are traveling and aren't following kind of guidelines, to have them stay home, work remotely for at least a week. We'd like 10 days and do that testing before they come back. It's just, now I say that, but what's the hot spot in the whole state? It's us. It's us. So if you're traveling in St. Clair County, you're high risk. All those people that are going to come here, it'd be us. So it's a little bit crazy to talk about. Honestly, if you're doing anything over spring break and staying home, the traveling thing was talked about because these things are talked about in a broad global way, spring break traveling. But the reality is the hotspot's right here. And so we need to think about that when you return to a setting where you are with other people. Okay, so travel to grandma's house, maybe. I don't know.
Right. All right. Is everyone who gets tested and is positive automatically signed up or entered into the PEG system? Or how do we register with the PEG system?
So it is required, if you are tested, for the testing to be reported. And that reporting system should put you into the PEG system, okay? All tests are now supposed to be reported. Does it happen every single time? No. I can tell you I've had a couple conversations with you all where somebody did a test for you and it never got into our system, and so we couldn't say that you were positive. So make sure you ask. All of these places, all the labs, everybody that does testing is supposed to be reporting into the MDSS system, I think within 24 hours. So you shouldn't have to do anything. Now, just in case, we do have a self-reporting jot form on our website. And if you're not sure, you can always submit your name to us. It's a little hard to keep up with 200 a day, but at least that way too, it's a backup system, and we'll make sure that if you've been diagnosed and positive, we'll make sure that we know about you and we get you into the system.
Okay. Next question. What about shutting down more things in St. Clair County since our numbers are so high? Different things have shut down in Macomb County due to their numbers, such as their government meetings, etc.
Mm-hmm. Well, any meeting that is open for the Open Meetings Act has been allowed to go virtual, and we sent out, as you know, a press release that said we want as many things to be virtual as possible, including workplace involvement. Restaurants, many restaurants are going back to carry out. So I'll be honest, I'm having these conversations every day with my colleagues, with the government, the local governments. Remember that a local public health order, if not done across the jurisdiction, is worthless. So it doesn't really help if St. Clair County is saying no indoor dining and there is indoor dining everywhere else. Okay, all it does is punish our businesses. And to do something like that, you need the full support of your local government and your local law enforcement agency. So it gets a little sticky. So we are going to do everything we can to reinforce and encourage people to do these things. If we have to do a specific public health order or restriction that's unique to St. Clair County, I can tell you, I better have some good data behind it to support it. And I don't think it's going to be a global across the board thing. A lot of businesses, by the way, and a lot of congregate settings, they shut down because they have to, because there's a case and so many quarantines that they don't have enough staff or support people to do what they wanted to do. So that's, I think, a more realistic thing. What we're going to see in the next few weeks is things are going to shut down because you can't function when this much viral load is transmitting through a community. And that's just the sad reality of things. But we'll keep looking at the numbers. If we need to go rogue, I've always said I don't want St. Clair County to be the one rogue state. But if there's some meaning to it and it's important, we would consider it.
All right. We did have a comment, someone saying thank you for doing this weekly Q&A, but they are alarmed about all the people asking about getting vaccines while having COVID, and they also asked us to accelerate our efforts to provide outdoor vaccinations and to also make sure the Knights Hall is well ventilated.
Yeah, and if you've been to one of our vaccine clinics, I can tell you we're getting better and better at this. Hey, by the time this is over, we're going to just have it down. Our vaccine clinics, even those large ones, everyone's 6 feet apart. It is well ventilated, but more importantly, you're never in front of an individual for really longer than 5 minutes, even at the vaccination station. So we're working really hard to make sure that exposure risk is minimal. Please don't come and get your vaccine if you're ill, if you think you might have COVID, or even if you've been exposed to COVID. Please complete your quarantine period before you get vaccinated. We're having more and more access to vaccine. There's no vaccine. I think in the next few weeks, we're going to not have a lot of vaccine shortages. So it's going to open up for everybody. So we don't have to worry about that. And I agree with you. We need to get some outdoor drive-through stuff going. Now that we have more vaccine, those plans are in the works. Up until last week, we got our vaccine and we used it all up, and we waited for our next allocation. So doing multiple venues was problematic and honestly wasn't very efficient with our staff. But we're working on that. We've got some great community partners, and I think you just keep looking for those avenues to vaccinate that you're most comfortable with. If you show up, by the way, at one of our vaccine clinics and aren't comfortable, talk to the people in the front, because we can also accommodate special needs. We can get a person to come out to your car and vaccinate you. Now, these are special requests, but we've had a lot of that, and we do our best to make sure that people are vaccinated in an environment that makes them comfortable. But we'll get better at it.
All right. Can you hear me, Doc? I think I'm frozen.
I am, but
okay.
I can still hear you.
Okay, good. All right, next question. The percent
you look
vaccination
really pretty,
rate.
by the way.
Oh.
Yeah, go ahead.
Thank you, Doc. The percent vaccination rate for St. Clair County that I see reported in state and media outlets is reported much lower at like 8 or 9%, but you have data showing a much higher rate around 27%. Is this just a delay in reporting, or does that 27% number include people who have had only one dose thus far?
Yes. Yeah. So I'm reporting to you guys because it sounds great. Anyone who's had at least one dose. All vaccine data is also reported in people. So if you go to our website got our vaccine data? I hope it does. Yes. You will see as well those who have been fully vaccinated and in various age groups as well. So you're right. I think fully vaccinated, although I think we're higher than 8 or 9%. And so there is a lag with the state data dashboard and what you're going to hear from us, because we're giving you the up-to-date from our vaccines from yesterday, where the state is a week behind. And when you're vaccinating 2,000 and 3,000 people a week, that number can change pretty substantially in a week, and it won't be reflected in the state's last week data. So I guess it's a little bit of both. But they added 8 or 9%, which is about 12% now for our county total that have had both doses. That's a great graph, Russ, but it doesn't show what this lady is asking about. That she's talking about the 27 and the 56%. That's at least one dose.
All right, Doc. Next question. Should I test again after those 14 days if I'm positive?
No. No, and the reason is that there are a substantial number of individuals, and we don't understand, who will continue to test positive, especially with the PCR test, well beyond the time they're infectious. So the science tells us that you are no longer infectious after 10 days, vast majority of people. Okay, so even though you're testing positive on day 14, day 21, or whatever it is, it doesn't mean you're still infectious, but what it's going to do is just throw everybody into a tizzy. In fact, we don't even count them. We won't even count you as a second case unless you're 90 days out and retest after 90 days positive. So we are discouraging retesting for anyone who's positive. If you're positive, just wait the allotted time, make sure you're feeling better, and go back to your duties. Repeat testing is not only a waste of resources, but it's a source of a lot of confusion. And if you even, no, just don't do it.
Okay. All right. Next
it.
question. Where can I get a vaccine? I've been on Myers wait list for over 2 months. I've been on the phone every day for hours looking. She's looking for help.
Oh, yeah, there's people that just really have struggled. It's hard to say. So Myers, CVS, no, Myers, Kroger's, Rite Aid, and some small pharmacies now have it. Some doctor offices have it. I don't want to throw those out there, but ask your doctor. And then, of course, our registration list is probably the largest one. We have, last I looked, how many people left on that registration? I don't have that number in front of me. I know for the elderly, it's a little over 7,000, which we're hoping we can get through in the next couple of weeks. So if you're under 65, there's more than that. It's not really surprising that you haven't got a call yet, but I think you will. I mentioned that our vaccine allocation really expanded this past week, and next week we're going to have 2 of our large clinics, plus we're setting up other situations for smaller clinics. So I think we'll start getting through that list a lot quicker. So just be patient, stick with it. You're probably in an age group that just recently opened up, and we just haven't gotten to you yet, but we will. Probably within the next few weeks.
All right. The next one, this woman says she had to go to Macomb County for her second shot because St. Clair County was spreading the Pfizer to 4 weeks instead of the 3 weeks. She said she had cancer treatment that day at St. Clair County and wanted us to come back. St. Clair County told her to reschedule her cancer treatment, and that she couldn't get her second dose until July. Can you just address that?
Yeah, well, I apologize. So we did, you can imagine the logistic complexity of using both Pfizer and Moderna and doing second dose vaccinations. And our second dose allocations are separate. We can't use second dose vaccine for first dose, even though they're exactly the same. The state counts them separately. So we did, when we do our first dose, I believe we're still doing this, our first dose clinics, we are having everyone come back in 4 weeks. And that's within the range of acceptability for both products. As I talked to the first lady, we were very confident that there's no increased risk of spreading out that vaccine, the Pfizer, doing it 4 weeks instead of 3 weeks. If you are an individual that has special needs, special concerns, you send your request through our COVID-19 email, and we'll do what we can to accommodate your needs. I don't know what happened in your situation, ma'am. I'm sorry. I'd be surprised if someone tell you not to take treatment. But if you're getting into a situation where you're being told things that don't seem right, please let us know. COVID-19 at stclaircounty.org. We do all kinds of variables for people that have special circumstances, and we'll certainly try our best to help you out. So I'm sorry about that.
All right, thank you, Doc. Next question, why are the high schools shut down, but sports are still being played? A lot of the cases are the sports players.
They were until they spread into the high schools. Sports are mandated now to test, which is also not the most popular. We have a lot of people who don't want their kids to get tested, but that's why they're there. That's why they're open. So the idea is if you want to play sports, and I'll even say, I think if you want to do extracurricular activities, you should resign yourself to at least weekly testing. And those sports that are very high risk, like wrestling and things where they can't use masks, cheerleading, they have to test 3 times a week. So there is a testing mandate for sports. And if the sports team gets into trouble, and they have a lot of cases and a lot of quarantines, they get grounded. They get quarantined as well. So it's not that we don't, we just take it again, as I said, kind of a case by case basis. Not all high schools have paused. Okay, not all. Some elementary schools have, some have not, and that's because each building, each school district, each school has a unique set of circumstances and data that differs from one to the other, and we try and follow the data more than kind of a blanket response to everything. I think it's the way we're going to do things probably for a long time. Because I'll tell you, let's go back to last March when we shut everything down. Did it work? Maybe. Yeah, you'd have to look at it and say it did. But look at the damage and the harm that it caused. I don't think anybody feels like that is the right direction to go, is to just kind of throw a big blanket on everything and stop everything. It's too damaging to our economy. It's too damaging to our culture, to our psyche, to everything. So we're going to try and do this using, kind of more precise, if you can call it precise. Not the most precise, but we are going to try and do it based on the situation. So
all right.
Sports have to test, and schools have to respond based on the number of cases that they have going on in their building.
All right. Next question. My dad had his first vaccine March 1st. He got a second dose on March 29th. On March 30th, he found out the person who cut his hair on March 23rd tested positive 5 days after my dad saw him. How long should my dad quarantine? 10 days or 14 days?
Minimum 10 days, ideally 14 days. Okay. Again, with all the variants going on, if he can do 14 days, that would probably be best. But if he needs to go somewhere and he's got an important job to do, things are happening, 10 days would be the minimum, assuming that he still feels well and he's still really careful for the next 4 days. And I think that's important. If you're going to take that shorter option of 10 days, please be very careful. Monitor your health closely. Kind of avoid vulnerable people if you can, so that if something did happen in those last 4 days, it goes down very dramatically, the risk, but the risk is still there. So you want to just be careful for those last 4 days.
All right. Thank you, Doc. The next question, when will the Johnson vaccine be in St. Clair County?
Soon. So we did get some that we used a couple weeks ago. We were focusing, because it's a 1-dose vaccine, using it in our jails, using it in our special populations where it's hard for these people to get back for a second dose. But we are going to be receiving more J&J, and that means that we're going to use it. We're not going to hold back. We're going to be using it. So our clinics, and I can't tell you which clinics we're going to do what, but our clinics, we're going to use whatever vaccine we have and put it out there. So I'm going to urge you people, though, one more time, that please don't hold off for any one particular vaccine. The vaccines have not been compared side by side. What we do know is they're safe. All three of them are safe, and all three of them appear to be very effective, particularly when it comes to hospitalizations and deaths. We have a staggering amount of transmission going on. With a looming concern of variants, we need to fortify our community with immunity and vaccines as quickly as possible. And that means get the first vaccine that comes your way. You're going to be in good shape either way.
All right. Thank you, Doc. Looks like we have about 10 more minutes left, so I want to shuffle through as many questions as we can. We still have a lot on the feed. Do they tell you when you get your results, what type of COVID you have, like the variants or just the regular?
No, it's not used for any kind of clinical diagnosis. In fact, your docs probably don't know. Okay. It comes to us for public health purposes, typically weeks after you've already completed your quarantine and your isolation. That's because genetic sequencing takes several weeks. It's used at this point. And we don't know of any clinical variation of a variant from the previous type. So remember, the standard COVID-19, if you will, is different than what started in the Wuhan. This thing has already mutated a couple times over. But if we do understand maybe that clinically it'll make a difference and what your treatment should be, that's when it'll get started to be reported to your hospitals, your doctors that did the testing. But right now it is just a public health issue to know where this variant is going and whether or not it's increasing.
And a follow-up to that, we had another question about the variant. Are all positive COVID tests sent for sequencing to determine the variant? If they are, is the COVID positive person informed of the variant they have?
So probably not every positive case, right? The lab is trying to get as many samples as they can. We send all of ours because we're connected with the Bureau of Labs, but there are dozens and dozens and dozens of commercial labs that did COVID testing, and I would suspect that some do a better job than others sending them. So I would say no. It's probably random and more from one lab to the other. The other part of that question is, if you have a variant, will you be notified? Yes. Okay. So once we know you have a variant, we're going to reach out to you and double check those exposures and double check how you're doing. Here's the unfortunate part. I can't tell you how many of these cases. So I think we've officially had notified of 36 variants now. I think every day we're getting a couple more. I can't tell you the number of people that are not answering their phones and not cooperating with us as far as getting further information. So unfortunately, it's a kind of a dead end, right? We assume those people have had other exposures, and it's kind of a dead end for us. So once again, it's important that you answer your phone and you answer those questions. It just helps us understand better where we're going.
And just to follow up on her question, will you be told what variant strain you have?
Yeah.
Okay.
Yeah. So far, St. Clair County has only had the B117s. There are 2 B135s in the state, and I believe there's 1 P variant now that was found in Bay City. We have not had any of those others yet. So yes, you would be told. But remember, we don't know what it means. If you look at the talking points that have been put out by the state and the CDC, we know that genetic sequencing is different. We know that most of the ones we're concerned about make the virus more transmissible, more contagious, but we don't know whether it puts you at greater risk of having a more serious illness or any of those clinical things. So I worry a little bit that people will put more to this than there is about their personal health. It really is important from a public health, a population level component, that if something's more contagious, we're going to see those spikes like I showed you at the beginning. I think a lot of that is some of it's got to be is behavior driven, what we're doing, but some of it's got to be variant driven as well.
Okay, I'll have this be the final question. And for folks, we had a lot of questions yesterday and a lot of questions today that might have gone unanswered. Please watch back this video on Facebook and also on YouTube. We have it time-stamped on YouTube right after we upload it. So please look there for those answers. And again, you can always email covid19@stclaircounty.org. All right, so the final question. I'm not good with computers.
Like
Is there a phone
Jeopardy.
number to call?
What's the answer? The answer is, I'm sorry, go ahead.
No, you're okay. I'm not too good with computers. Is there a phone number to call to get signed up for the vaccine?
Yeah. What is it? 966 4163. So that's 810-966-4163. You can also call our main health department number. Some days are better than others. How are we doing now with our call center? A little calmer?
We have our wonderful new Everbridge team.
So, you know, when things happen out there in the community, we have days where you can't get through. The phones just ring and ring. And we try and respond to that by adding more staff, adding more phones. There was a limitation of how many more phones we could add. Technology is a wonderful thing. So we try and respond to that. But you know, this pandemic has not been static. I mean, I think that's the thing that's most frustrating to all of us is, you know, you get used to something, we set up a system to respond in a certain way, and then something changes. And then we have to scramble to change. So I'm just saying that if you've had difficulty getting through to us on the phone, please don't give up on us. Try again. We're trying to respond and do that better and better. The COVID-19 or email is always better because it's never busy. You'll always get through and we'll always look at it. But the phone system has been improved on, and I think if you want to give us a call, please do. We've got great staff that are there trying to answer your questions. So,
all right. So, Doc, any closing comments?
I'm scared too. Okay, this is different. The speed to which this is happening, and maybe it feels different because we're just all so sick of it. You know, we got through it and then it started to get better, and now it's getting worse again. It's hard. But, you know, if we don't do this right, we're going to be doing this over and over and over again. And I think one thing this virus has proved is that it is not going away. It's not going to just disappear. It's going to change and mutate to its advantage, and we have to be smarter than this virus. We are smarter than a virus. A virus has no brain. It's just a little genetic piece of material wrapped up in a protein coat. It's brainless. It has no purpose in life other than to infect us. And I think we can do this. But I just want to urge everyone not to give up, not to throw your hands up and say, I don't care anymore, because I think that's how a lot of us are feeling. We're just tired, and it's hard to respond. So I want you all just take a deep breath, take a walk, take care of the people who need to be taken care of, but don't give up. I think we can do this, but I think the next few weeks to a month is going to be hard. I think it's going to be hard, and I think we're just going to have to get ready for it and do what we got to do. And when it's all over, we'll regroup and decide what we did wrong and what we can do better the next time. And we're gonna get really good at this to the point where it's not gonna seem so hard anymore. That's my belief, and that's what I want to pass on to you guys. So hang in there. See you next week.